Welcome, everybody. You're listening to Westchester Talk Radio, produced by Shark Creative and made possible by Entergy, Indian Point Energy Center, Lapolis Electric, White Plains Hospital, Wartburg, Hightower Westchester, and Park Sterling Realty. We're back for isolation therapy. This is episode 7, and I'm here with Dr. Justin Kolnick of Advanced Endodontics of Westchester. Dr. K, as I like to refer to him as. How are you? It's great to see you, certainly under some different kinds of conditions here, but welcome. And it's so nice to have you on today.
Yeah, thank you. Thank you for inviting me during these difficult times, especially in relation to the type of work I do and how we've adapted to treating patients during this pandemic.
Yeah, very interesting. Certainly these are unprecedented times, as we keep saying. And, the whole idea of this is to get some perspective from different people in the community, and you're certainly on the front line in a lot of ways. If there is an emergency and someone needs help, they come to you for your practice. And we want to educate our listeners and your followers on exactly what you've really uncovered. And this is Dr. Kolnick, by the way, who went to Columbia University College of Dental Medicine. He's got 2 practices, one in White Plains, one in Mount Kisco, 5 different doctors that have come together. He heads it all up. We've gotten to know each other over the last several years, and it really is a pleasure to have you here. Dr. K, why don't you share with us exactly what you're finding out, and what is it that you've learned during COVID that's so important, and that's kind of revolutionized the way you have to treat patients right now?
Well, I think it's best if we switch maybe to my screen so I can talk and show at the same time.
By all means, a little show and tell. Won't hurt anybody.
Show and tell. So this is part of a presentation. I've been doing webinars. This is I've done about 5 webinars in the last 2 weeks, international, national, and this is really about the lessons that we have learned during this COVID-19 pandemic in our endodontic practice. So our practice is quite unique in that we've developed a specific protocol for management of emergencies in endodontics. And what's happened with this pandemic is that it has really devastated the clinical practice of dentistry. It has devastated almost everyone, but as far as our topic today, in dentistry, the emphasis is on only providing emergency treatment for patients.
Right. So if I just have, obviously, tooth cleaning or just sort of minor pain, that's not something that we're going to be able to address today.
Yeah, well, so this is the treatment dilemma. What constitutes an emergency? Certainly acute pain, swelling, pain that you can't control with over-the-counter medication, pain that wakes you up at night. These are all issues that we need to deal with. So, so what we've learned during the pandemic is that the majority of dental emergencies are of endodontic or root canal etiology or cause. So, myself and my colleagues who are endodontists, we're on the front lines in delivering emergency care because most general dental offices are closed and they are referring the emergencies directly to our office. So the problem is that all patients, the dentists, and our staff are reluctant, of course, to risk unnecessary exposure to the virus. So the ideal treatment option for these emergencies would be a single visit root canal procedure where the entire procedure is completed in one visit. Traditionally, with emergencies, with many of the emergencies, the treatment is done in multiple or 2 visits. So we've developed a protocol called Radial Apical cleansing to minimize treatment and post-operative complications.
So you're lowering the risk of being together more than once, if you will, during this epidemic.
Yeah, and that's for the patient, for ourselves as dentists, and for the staff. Obviously, within the office, we are working very high level of protection for ourselves and for the patients. Even our front desk staff are working from home and connecting to the office remotely. So this new protocol that we've developed is called Radial Apical cleansing, and what it does, it relies to a great extent on the use of lasers in root canal therapy. Now, I've been on your program several times, and this is a topic that I've discussed many times because we've been involved with lasers now for over 10 years. Basically, this is a protocol that deals with the infection and the complications that we encounter during root canal therapy. So the whole idea of this is to enhance the endodontic experience for the patient and for the endodontist, because the patient's under stress, but so are the endodontists and their staff. And it's very important for us to make sure that the patient has an excellent endodontic experience, and that the experience for the endodontist or the treating dentist is also a very positive one in terms of our ability to get this work done in a single visit.
Yeah, and how important that really is, obviously today more than ever. And I wonder, first of all, how often are you seeing people? I mean, are you finding that there are a lot of emergencies happening right now, or is this keeping you busier than normal?
Well, we're not seeing regular patients, so we're working out of the White Plains office, and we've divided the office up into at least 3 teams, where in the event that a member of a particular team gets sick, then the entire team is quarantined, and then the next team can come in to treat patients. So we've developed a very sophisticated treatment protocol.
Mm-hmm. And what do you think will happen, when we get back to some normalcy? Would you...
No one seems to know. No one seems to know. But part of your previous question was, we can see, we're seeing anything from, 7 to 10 emergencies a day.
Wow.
So, and between the 5 of us in the office, we're able to manage. And, our main concern, of course, is to get the patients out of pain.
Mm-hmm. Yeah, and listen, and dental pain does not discriminate, right? They're still gonna have it no matter what.
Absolutely.
Certainly we're grateful that you've been able to find a way to minimize the amount of exposure for both you and for the patient, and do it in a way that they can accomplish the same goal during this very difficult time. I tell you, I'm sure you're in touch with a lot of the dentists that are out there. I know you work very closely with many general dentists, and you provide a very, very important service to them. Is there anything that you want to leave with them? Any parting notes to the dentists that are out there that may be looking to you for some guidance or advice?
Well, I think, my colleagues pretty much know that they need to certainly protect themselves and their staff in terms of exposure. They need to know that endodontists like myself are available to treat these emergencies. So, we don't necessarily want the patient to first go to the dentist and get exposed there, and then get referred to us. So most of our referrers, and we work with about 600 dentists in Westchester and surrounding counties, and we ask them just to triage the patient over the phone and see if they think it's an endodontic problem to call us directly.
Yeah. All right. Well, look, what a pleasure it's been to see you, Dr. Kolnick. It's always a pleasure, truthfully, and love what you're doing. Keep up the good work. Let's get through this difficult time together, and we'll see you soon enough. And hopefully,
absolutely,
it'll be in White Plains or in Mount Kisco somewhere. Say hello to your staff. And I'll just remind everybody once again, you have been listening to Westchester Talk Radio, which is produced by Shark Creative and made possible by our friends over at Entergy, Indian Point Energy Center, Lapolis Electric, White Plains Hospital, Hightower, Westchester, Wartburg, and Park Sterling Realty. We'll be back with another episode of Isolation Therapy very soon. Thank you.
Thank you very much for having me on.